Hi everybody, Dr. Daniel, and today I'm discussing GammaCore, a new vagus nerve stimulator treatment for migraine. In general, migraine is a genetic condition that's inherited through your DNA. The genes that transmit migraine have been found and published in the medical literature. Migraine occurs in 25% of women and 6% of men. For women, migraine is their most common chronic medical problem and more prevalent than diabetes, heart disease, or arthritis. Migraine is the fifth most common cause of disability worldwide in men and women and causes a large amount of clinical and economic burden. It's found in 12% of people in the world. And migraine causes more than 1 million ER visits every year. An attack of migraine, according to the International Classification of Headache Disorders, number 3, lasts 4 to 72 hours and is called episodic migraine if it occurs less than 14 days per month, or chronic migraine if there are more than 15 headache days a month, 8 of which have migraine features. Current therapy for migraine acutely involves using NSAIDs, caffeine, DHE, one of the 7 triptans, one of the new CGRP receptor blockers, or Rayval. All medications have possible side effects, and too much medication may lead to medication overuse headache. Does GammaCore treat migraine? GammaCore vagus nerve stimulator, abbreviated VNS, provided relief for more than 50% of attacks for acute treatment of migraine headache. GammaCore VNS is safe and effective. Some adults felt relief in 30 minutes. Almost half of patients had little to almost no pain within 2 hours. The majority of patients who were pain-free at 2 hours remained pain-free for 48 hours. GammaCore is effective for patients who fail traditional oral or injectable medications such as triptans, caffeine, or NSAIDs. GammaCore treatment for migraine avoids medication side effects and limits the possible development of medication overuse headache. So, related questions. What are the side effects of using GammaCore? GammaCore-treated patients did not have any serious treatment-related side effects. Most of the reported side effects were mild, only occurring during the use of the device, and went away after each treatment. The most common side effects were discomfort and redness at the application site, dizziness, and a tingling feeling where the device was applied in the neck. GammaCore has been shown to be safe and effective across a range of migraine populations in both the United States and Europe. Different treatment strategies have been evaluated showing good clinical, safety, and quality of life outcomes at various treatment study times. How does GammaCore work? Well, GammaCore is a vagus nerve stimulator, and the vagus nerve is one of the largest nerves in the parasympathetic division of the autonomic nerve system. GammaCore activates the vagus nerve by mild electrical stimulation. GammaCore therapy is not indicated for children, pregnant women, or patients with active implantable medical devices. It's also not indicated for patients with carotid atherosclerosis, hypertension, bradycardia or tachycardia conditions, or those with a metallic device. It shouldn't be used in patients with a stent, bone plate, or bone screw near the neck. It also shouldn't be used at the same time as the use of a mobile phone or other portable electronic device. What's the function of the vagus nerve? The vagus nerve connects the medulla of the brainstem with the various target organs in the body. One of the most well-known functions of the vagus nerve is to cause the cells the lining of the stomach to secrete acid to aid digestion. The vagus nerve helps regulate pain. The vagus nerve shuts off inflammation in the body, and migraine is an inflammatory medical condition. Vagus nerve stimulators are also used to treat depression and epilepsy. The vagus nerve has the longest course of all the cranial nerves, extending from the medulla in the brainstem to the abdomen. Its name is derived from the Latin vagare, which means wandering. The vagus nerve originates from the medulla of the brainstem to neurons in the stomach, the upper and lower bowel, the bladder, and all the sexual organs. Electrical treatment. This discussion of previous treatment options for migraine leads to a new electrical stimulator, drug-free method of treating migraine, the GammaCore vagus nerve stimulator. GammaCore produces a proprietary low-voltage electrical signal comprising a 5 kilowatt sine wave. The device is placed vertically below the chin, and stimulations are made until the patient notices contraction of the lower lip on the treated side, indicating its location of the stimulation over the vagus nerve. Excuse me. Clinical results. A prospective double-blind sham-control study of vagus nerve stimulator for the acute treatment of migraine was performed, called the PRESTO study, and the non-invasive nerve stimulation for the prevention of chronic migraine event were also performed. PRESTO included 243 patients with episode migraine. More members receiving the stimulator were pain-free at 30 minutes, that is 12%, than those receiving a sham treatment, which is 4.2%. There was also a greater percentage of the vagal nerve stimulator group who were pain-free at 60 minutes, as noted. The PRESTO data suggests that GammaCore was rapidly effective, well-tolerated, and practical for the acute treatment of episodic migraine. That's a statement from the principal investigator, Cristina Tassarelli, director of the Headache Science Center in Pavia, Italy, in a press announcement released in 2017. In the event study, 59 chronic patients with migraine for preventive treatment formed the study population, and persistent prophylactic GammaCore use was associated with continued reduction in the number of headache days. So those are my thoughts today on GammaCore, a new electronic vagal nerve stimulator for migraine for acute therapy. I hope this is helpful to all of you. Please click like and subscribe down there. And then follow me on Podbean and other podcast sources like Apple, Podbean, or Spotify. And I will see you on the next talk.